Every second of every day, high blood pressure operates as an invisible, relentless mechanical force. It forces blood through constricted, rigid arteries, slowly damaging the vascular system from the inside out. This chart shows the stark reality of hypertension treatment globally. We have dozens of cheap, highly effective blood pressure medications available, yet roughly 80% of patients taking these pills fail to reach their target health goals. While these medications are biologically capable of lowering pressure, the logistical requirement of a perfect daily regimen creates a significant barrier. For many, the long-term burden of maintaining 365 doses a year leads to gaps in treatment. When a patient misses even a single dose, the medication levels in their blood drop. This creates dangerous peaks and valleys in their blood pressure, a phenomenon known as visit-to-visit variability, which is a known trigger for sudden cardiovascular events. Reducing the global burden of heart disease will likely require a management strategy that functions independently of daily human intervention. Current medications operate downstream in the bloodstream. They work by attempting to block the enzymes and receptors that tighten blood vessels after the body has already initiated the signaling process. Maintaining a safe baseline pressure with these tools requires a constant chemical presence in the blood. If the daily supply stops, the signaling system immediately resumes the dangerous pressure cascade. Zilebesiran is an investigational therapy that uses RNA interference to address this signaling at its source. It is designed to silence the genetic instructions responsible for creating the hormones that drive high blood pressure. This flowchart maps the chemical cascade causing hypertension. Traditional treatments act on multiple branches at the bottom. Zilebesiran travels to mmHg, targeting angiotensinogen, the sole precursor triggering this system. Silencing AGT production at the origin prevents the downstream cascade from beginning. By shutting down the most upstream component of the system, this therapy moves hypertension management toward a model of sustained biological suppression. Researchers tested this upstream approach in the KARDIA 1 Phase 2 clinical trial, which enrolled patients with mild to moderate hypertension. This chart illustrates the results. A single 300 mg dose of Zilebesiran reduced systolic blood pressure by up to 16.7 mmHg of mercury compared to placebo. Following that injection, blood pressure reductions were sustained for a full 6 months. This suppression remained stable throughout the entire 24-hour cycle. This consistency effectively eliminated the fluctuations often seen with short-acting daily pills. The therapy was generally well tolerated. Reported side effects were mostly mild, like reactions at the injection site. The KARDIA 1 results suggest that a biannual dosing schedule could provide the continuous blood pressure control that many patients struggle to maintain with daily regimens. These findings point toward a future where hypertension could be managed through scheduled clinical visits twice a year, reducing the need for daily patient oversight. However, because Zilebesiran is still undergoing investigational trials, current management still relies on existing tools and daily adherence. Since the clinical evidence confirms that variability in blood pressure increases risk, maintaining a strict schedule with current medications is essential. Setting a precise daily alarm can help minimize those dangerous fluctuations. The Phase 1 trial also identified a key factor in drug efficacy. A high-salt diet was found to weaken the blood pressure-lowering effects of the treatment. This indicates that regardless of the medication used, reducing sodium intake is a biological necessity. Salt acts as a direct counterforce to most blood pressure therapies. Long-acting RNAi therapies may soon change the logistical nature of hypertension care. Until then, the most effective ways to protect the vascular system are consistent daily adherence and disciplined dietary choices.